to Community Health. I'm Dr. Eric Smith, your host. I'm a psychologist and a licensed professional counselor. Today, as a guest again, is Leo Roisman, and he is a licensed clinical social worker. We're going to talk today about complicated grief. And Leo, they're different concepts, aren't they? Grief can take a lot of different forms.
Yeah, sure. I guess we should start with, defining what grief is, bereavement, loss. Yeah. So that's when, someone in your life dies and you have several symptoms that kind of take over. And this has been studied over time because, this is part of the human condition. So some of those, symptoms we can talk about are perhaps insomnia, weight loss, feelings of intense sadness, anger. Some people even describe sort of having hallucinatory experiences following a loss. Where I think the distinction comes in of, you had mentioned complicated grief, is when that loss carries with it either some kind of unfinished business, perhaps, with the person that passed, or you have some other diagnoses like say anxiety or depression or what have you that sort of come up even more so, intensify perhaps, after that loss, like a triggering effect.
Yes, and so daily functioning gets damaged over a longer period of time than expected, right. And it's hard for coping skills to overcome that. Right.
But the interesting part of a typical grief is that there is it's a little bit different in that it doesn't last as long as a atypical or complicated grief. It can be a few months, and really those symptoms that we discussed should be decreasing over that time, and generally after a year, we really regain normative functioning. Whereas the atypical or the complicated grief, that can last for a very long time.
Is there a lot of resistance to when it's atypical grief, complicated grief, to where they're not noticing after a year that this is going on? Maybe friends and family are the ones who are noticing.
I suppose that's true. I think with any diagnosis, right? Sometimes it's hard for us to notice that we're still undergoing this, and sometimes just having a friend say, "Hey, it looks like you're still having a hard time."
Yeah, definitely. Yeah. So what role does the counselor play in this process?
Sure. So there's various types of counseling, I think, that would be really effective, that are rather very effective for people who are going through complicated grief. Again, depending on what it might be, but essentially talk therapy, right? Something that we do. A grief group, those are quite successful, sharing your experience with others that have gone through, who are going through maybe even similar symptoms that you are. And of course, like I said, time. Sometimes time is, sometimes time actually does help, because typical grief is, like I said, it's about a year or so, right? Because we have anniversaries, we have birthdays, we have all those experiences that we shared with the person that we lost, who was, a large part of our life. Our experience of dealing with this event, this triggering event, or perhaps some kind of going to a restaurant that we were there with this person, can bring about the same emotions. However, the difference is with a typical grief is, it happens to us, we experience the sadness or what have you, symptom, and then there's some kind of progression to wanting to feel better. okay, to normalize again. And that's why essentially about a year is what, the grief process, makes, sort of goes through and makes it easier for us to continue living our life. Whereas with atypical grief, there's unresolved business. There's, too many things going on at once. A type of atypical grief is called compound grief, where we have several instances of deaths and loss in our life, or it's a tragic event, and there's a lot more to work out there, something unexpected.
Does it relate to maybe getting bounced back into different stages of grief as you go along, or?
Yeah, we do go through several stages. The psychiatrist Kubler-Ross had developed sort of her theory on stages of grief. Very interesting. It's we sort of bounce around in all these different stages, but ultimately, in her theory, we should be getting better. We should be going through acceptance that we have this loss, and going back into our normative everyday life, going back to work, enjoying experiences with our loved ones again. So with atypical grief, though, there's something that's blunting that and preventing that from going on. And so, we, as clinicians, we try to work with those people to figure out what that might be.
Is it safe to say there's no normal response to grief, but things can become abnormal if they're extended and severe and really damaging to the day-to-day process of progressing in your life?
Yeah, that's correct. We can start re-experiencing some of the hardships that we went through when those triggers just start coming off. We start to isolate. There's a lot of depression-like symptoms that we can go through that certainly are concerning, for those around us, as you said, or to a clinician to work with.
So a severe depression could be a byproduct of the grief?
Right. If it's atypical, there's a lot more to work through, and the symptoms are very similar. We wouldn't say that it's ultimately only depression. There's certainly other symptoms that can happen, but depression seems to fit the bill for insomnia, appetite loss, of having just not being able to get out of bed, sadness. Some
of the symptoms could be maybe even anger.
Right.
Bargaining.
Oh, yes, of course. So those normative reactions, I guess, of feeling sad when someone's lost, or wanting them to be back, figuring out if only it was like this, that person could be with us again, or just not being able to focus and really wanting to have them in your life again.
Guilt and survivor's guilt.
Right. There's certainly a lot of that. Why was it them? Why was it not me? A lot of that does happen. And these are all normal. These are all normal, typical signs of grief that, we all should ultimately go through. It's like I said, it's part of the human condition. Whereas I think what we're really talking about is when it's not your typical, when there is so much surrounding it, is where, complications begin, where it's prolonged, it lasts for longer, where, either a depression diagnosis is appropriate, or just there's several others that we can use if it's very much grief-centered as a diagnosis, and we can work through, those symptoms. And certainly cognitive behavioral therapy comes to mind as a really good way to, work with someone who might be just stuck in a cycle of the sadness or what have you that
could
they're
be
going
the
through.
Therapist gently challenging you to come out of your symptoms, even your denial of what's going on for you.
Perhaps, yeah. It's those are certainly denial is quite a big symptom. and the therapist would really see what you're working with, where your cognitions are affecting your behavior, and why you're sort of missing work, or somehow behaving in a way that is ultimately hurting those around you.
It's complicated in the sense that someone could go through, like you said, compounded grief, and it could be completely unfair, but they could have a string of tragedies and misfortunes, and be completely overwhelmed, and need support, and need special consideration even from work or something like that for time off. Or
Right. I mean, that's certainly, I think most employers will allow, either some kind of, I forgot what it's called, where
bereavement.
Yeah, I mean, for bereavement, absolutely. But I mean, any kind of issues that you might be going through, I think, a lot of employers are thankfully a bit more aware of, mental health needs these days. And hopefully, thanks to this show, we can get more information out there.
That's true. So you can look up these support groups online, perhaps. You could definitely look up a counselor online and ask them for advice on where to look.
Yeah, there's a whole lot of grief and support groups out there. Some are telephonic, some are over Zoom. Certainly after the pandemic, many of them, and many of them are back in person again, which is great. If those are not effective for you, or if there's something that's preventing you from going there, perhaps individual counseling would be the best way to go.
Yeah, I was always thinking it's interesting that you always find some grief in life, and some people have not experienced a lot of grief, and then there's people who have experienced a lot of grief, and it's maybe two different bodies of knowing or wisdom or whatever.
Okay. What you're saying is that some people have sort of not been initiated, perhaps.
Exactly.
Yeah.
I find that interesting. And a counselor, you might want to ask your counselor what they know about grief, if that's something that they're comfortable with and have experienced.
So I worked in a hospice program for quite a lot of time, and several years, I should say. And we are dealing with, anticipatory grief, where we're working with a patient and their family who are, the outlook is that death will come at some point soon. And so a lot of similar skills are used. You're feeling sad, you're feeling isolated, you're feeling lost, and a lot of those skills are certainly helpful. And what I found is, people who have an expectation that death will occur and are able to start processing some of these things before, even for those who have never experienced loss, they certainly it's a gentler impact. It's certainly an impact. It's going to hurt, but it's a gentler impact in that you're able to make linkages with life, and things go on, and death is just part of it.
That sounds incredibly challenging.
I mean, initially, yes, it was. It was really like awe-inspiring, just being in that process. But the group of people that I worked with, and generally you'll find in hospice, nurses and pastoral counselors, and you're working as a team for the security and safety and purpose of this family's experience.
Isn't that generally a no-cost solution, hospice?
Absolutely. Most hospices are covered by the federal government, regardless of what your insurance is, and it's certainly regulated by the federal government, but it's also just such a wonderful program that is great. Really almost at no cost to you.
That's amazing. That's really good work. And someone could volunteer at a nursing home if they wanted to learn about grief and death and dying.
Yeah, perhaps. I mean, nursing homes certainly see the aging process. I'm working in a few nursing homes, and as a hospice clinician, I worked in several nursing homes. But not all nursing homes are really geared for somebody going through the stages of active death, and oftentimes we'll either get a hospice provider to come in to support them, or we'll have them go to either a hospice facility or a hospital, which oftentimes are in the same place.
It almost sounds cliche, but some people go through this alone, and some people use the "it takes a village" and get a lot of support.
Right.
Just depends on what your traditions are, your beliefs.
Yeah, that's true, and there's so many vast traditions of how we deal with death and dying. I'm Jewish, and so we have sort of integral part of Judaism of the experience of when someone dies, and what we do to remember that person, how we welcome the community to experience that with us. And I think a lot of other traditions, I'm assuming, I don't know, I can only speak for myself, have very similar experiences, which is it certainly does help to have others there experiencing this with us, and soundboarding. I think that's why bereavement groups rather are so successful, in that sharing has some integral part of bereavement and loss and grief that helps you heal.
Definitely. It's hard to, well, I know from experience too, it's hard to sit with a relative who's passing. It's a strange process, and it's very painful, and it's very comforting and compassionate too, but it takes a lot of fortitude, I think.
Selflessness, to really stop thinking about your process and just be there for that person.
So these are all things a counselor could help you with.
Absolutely. I mean, these are skills. We if this is our first time and we haven't had so much experience, sometimes we don't know what to do. We feel uncomfortable. What should I do? Should I do this? Should I do that? And having someone support us in, okay, it's okay, this is normative, we're going to do this, and this is what helps, and how do you feel about it, right? It's very important for us to ask our clients and patients. So we work with that. We work with feelings. We work with concerns, insecurities, and what have you, to help the coping for that person, and for them to be the caregiver, I guess, if that's what their role has become.
That sounds great. I imagine with a family system, sometimes a death brings out conflict and a power vacuum and disagreements, and you're not always on the same page with relatives and friends and loved ones on what to do and what even roles to take toward the dying or the dead.
Yeah, so I guess what you're saying is family counseling might really help in getting some of these dynamics out, some of these, roles, if you will, rather, these roles of the players involved here, to sort of come together and be a unified team. That could certainly be a good goal. I've certainly had family meetings about, expectations, about ways to support, and certainly sitting down if need be, even with a lawyer. Not a lawyer, but certainly can refer to, somebody who would work with wills, or would work with, the next steps, I suppose.
Yeah, the roles that loved ones need and want from each other might be different from what they're perceived or what one wants for themselves to play. There could be an image of what role to play in death and dying garnered from TV or something that's not very accurate.
Right, it's not very accurate. Once you're in it, you quickly realize how inaccurate it is. We all do have a role to play, and we certainly will be affected one way or another by death and dying around us. Certainly, working with kids kids sometimes are too young to really understand, or they still look for meaning. So it's finding on what age this child, what maturity this child is, and what their concept of death can be, to help them sort of maybe create some sort of memories, memory boxes we work on. This very lovely organization that would send you, like a cast, and so you would hold your hand and the person that's leaving hand, and make a cast of them. That could be like a memoriam for you. Those
it's amazing, yeah. Death and dying, and sometimes people die and your tradition gets challenged. You don't know what to believe, or what you thought you were supposed to believe doesn't hold true because you're so overwhelmed or whatever,
right,
or just so perplexed. And
sometimes the person's wishes might counter, to what you had thought. If the sometimes cremation versus burial, or other things that sort of conflict with the traditions that you grew up with, or the traditions that your loved one grew up with, and sort of teasing that out, like who has the say, what should be the say, and what's right by the person that passed. Certainly those kinds of family meetings often do occur as well.
Definitely something you could do in a counseling session. A counselor could facilitate that.
Absolutely. The great thing about hospice is that, like I said, as a counselor, that was a very big part of my role, is establishing a family meeting, having a lot of the players come and talk, have a chance to talk and open up and express themselves while they're actively grieving. Those are near and dear, those kinds of counseling sessions where it's very heavy, it's very emotive, and still being able to get to a place where we have some sort of agreement. Might not always happen, because families are complicated.
Definitely.
But we do our best. We really do.
How do you get someone to get used to their what if they're dying, their own death, and their own grieving of themselves?
Those were certainly there, certainly working with the patient about what kind of lasting memory they want to leave. Maybe having like a life review, just talking about what their life looked like, what they did, positives, negatives, everything. Who they're leaving behind, what they're leaving behind, what kind of hopes and goals they have for those people that are there. And then just processing their own sadness, that it's okay to cry, it's okay to feel sad, you're losing yourself.
Yeah, we're all grieving all the time, in a sense. We're all marching toward finality.
Right, it's true, but we don't think about it. When somebody is given a diagnosis that they have, in hospice it's 6 months or less, but usually it means, a month or two, if you're really able to understand what's going on, or sometimes it's even much less. You have very little time to really come to terms and start to process, what I want.
It's wonderful. Well, thanks again, Leo, and thanks for coming to
Thank you so much.
Community Health. And we have our contact information here at the end of the show. If you have any questions about any subject in mental health, we're happy to help. See you next show. Thank you very much.
Thank you.